Let me get that one.
No, come on. Now let's sit down, everybody.
You're okay?
Well, good morning. It looks like we have had everybody enter in from the waiting room. So we'd like to welcome you all to Bridging the Gap, Self-Health, One Key to Success. We're going to talk about youth health transition and transitioning your healthcare. So we're excited to have you all here today. And by we, I mean that I don't get to do this alone, which is fantastic because I hate doing anything alone. My name is Tim Markle. I'm director of the Southern Regional Center for Children and Youth with Special Health Care Needs, and I work with the statewide Youth Health Transition Initiative team. And I'm joined by a couple other people today that I like to let them introduce themselves before we get into the presentation.
Hi, I'll go second. My name is Beth Guthrie Moss. I am the coordinator for the Youth Health Transition Initiative that Tim just talked about at the Wiseman Center. I also am a parent of an adult with who has autism. He just turned 28 yesterday. So, yeah.
I'm Abby Tessman. I am a cutting edge graduate. I created my own business and I'm on the CSC.
And you will luckily get to hear later from Abby and Beth. Matter of fact, the whole point of my part of the presentation is to get through it so that we can hear from Abby. That's just basically why I'm here today, because I want to hear from Abby. So let's go ahead. We'd like to know a little bit about who's with us today. So if you could take a minute to just put your name and where you live in the chat box would be very helpful because we are a statewide entity and so we cover a lot of ground. And so we kind of like to just at least know who's in the room with us and where they're from. That'd be very helpful moving forward. Also be very helpful if I then opened up my own chat box so I can see your answers. You guys are from all over the place. This is fantastic. We got some large cities. We got some tiny towns. Oh, well, welcome everyone. Well, thank you so much for being here. This is just really exciting to have so many people together in one place. So hopefully we will continue on here and take your time putting that in. We're not going to go away anywhere. So no hurry, no rush. We'll continue on, but if you could just keep putting those in so we can kind of see where our reach is at, that would be very, very helpful to us. I am representing the Youth Health Transition Initiative, but I am part of a bigger group of folks that work throughout Wisconsin called the Wisconsin Children and Youth with Special Health Care Needs Program. It includes a number of partners that help us with health benefits, resource, with medical home, how to get along with your doctors. We got people that talk about parent-to-parent support, as well as really strong advocacy and how we can raise our voices together to make changes. All these partners come together to provide the network of support. And with them are our 5 regional centers. The 5 regional centers, well, there's 5 of them. They're throughout Wisconsin. And there is one in your area. And so you'll notice that, as I said, I'm director of the Southern Regional Center. So I'm down in that orange area, down in the bottom there. But we have regional centers throughout Wisconsin so that wherever parents, families, and providers are that might have questions about the network of support, finding resources, information about the Children and Youth with Special Health Care Needs Network, we are there. So now that we've gotten you used to using your chat feature, we're going to also introduce you to the poll feature. So let's go to it's poll time number 1. What region do you live in is our first poll, I believe. And then the second question is, have you ever contacted your regional center? So go ahead and let's see what region you're in. From the outside, I'm going to say that we have a lot of people from Southeastern. That's going to be my guess there, but I don't know for sure. We're going through, but we seem to have a lot of the Milwaukee area. And then if you contact your regional centers, because that'll let me know whether I need to drone on for 30 seconds or 1 minute about the regional centers.
Good to know.
So we have over 50% of the vote in. All right, we're sitting at around 60%. And that's going to be, I think that's going to give us our good enough total for this point. So in case you're wondering, most of y'all are from southeastern Wisconsin. And so Milwaukee area, welcome, way to represent. Nice job. Followed closely by Southern, but a lot also from Northern and Northwestern. And that's just really exciting to see you guys here. And then contacting the regional center. None of you say that you have, which doesn't surprise me, as a lot of you seem to be adults, which means that maybe you hadn't contacted your regional center, but maybe back in the day, maybe your parents did. So we're going to go forward just to let you know that those regional centers are out there to help you identify resources, supports, and advocacy opportunities in your region. So let's go ahead and we're going to continue on. With the Health Transition Wisconsin, we are a statewide initiative. And so we have just a couple of main ways that we provide support for people. One of them is through our website. We encourage you to visit us at healthtransitionwi.org. We also provide materials such as a brochure, which we'll look at a little bit later in the presentation, a health pocket guide, which is a great way to keep track of your day-to-day health concerns, along with stuff like a transition resource checklist. And we also provide different trainings for families. So today, where we're going to be going is that we're going to define youth health transition and why it matters. We're going to look at a couple of tools and resources to help you increase your self-health awareness, the ways that you can see if you are taking as much control and taking charge of your healthcare as much as you can. And then we're also going to discuss disclosure and advocating for self-health. So how do I tell people about my condition? How do I explain to people the differences that I have and the differences as I make my way through the world? Because we all have different ways of making our way through this world. So how do I tell employers, educators, friends, family about that disclosure? And then how do I advocate? How do I stand up and say, you know what, this is what I need to be optimally healthy, to be the most healthy I can. This is what I need to do. That's what self-health is all about. So we're going to go on, but first, just think to yourself, we all deal with the world of acronyms. So if I would put the acronym LOL up on the screen, would you all know what that means? You can feel free to put it in the chat box if you want. What LOL would mean, please try to keep it nice and clean. Absolutely, it is laughed out loud. And Heather, I am reading the chat, and I will try to drone on about the centers a little later. I promise I will try to my best to get back to them. But yes, it is laugh out loud. Not love our lots or anything, loving whatever those jokes are with LOL. But I may use acronyms throughout the day because I'm used to them. It's the way that I do shortcuts in my speaking. We all use them. So if I ever use an acronym you're not sure about, please feel free to put alphabet soup, put acronym alert, put knock, put anything like what in the chat box. And that will remind me that I did not explain my acronym. So please feel free. I want to make sure you understand what we're talking about. So let's get into what is this healthcare transition thing that I am talking about. When we talk healthcare transition, we're talking about the process of changing from a pediatric to an adult model of healthcare. Now, some of you are sitting there going, well, I didn't have a pediatrician. I had this adult provider. I had a family practitioner, or I've only seen a nurse practitioner. I've never seen a pediatrician. Well, the truth is that there's ways of treating youth and the ways that the pediatric clinics are set up that are different from the way that the adult models of care will be set up. And so we need to figure out, what does that transition look like? So who needs to worry about this? Well, basically all teens who are turning 18. becomes especially important if that youth has a disability or a healthcare need. Is there some things that can just slide by? But if you have a healthcare need or disability, or your health is really important and you need to stay on top of it, then you really need to make sure this transition happens smoothly. Why is health important? Why do we even care about this? I believe that the healthier we are, it increases our amount of independence that we can have and increase our success in our day-to-day life. When we're healthy, we can do more. No matter what our abilities are, we need to be the healthiest that we can be. And to stay healthy, we need to understand, what does my health feel like? And more importantly, sometimes, what does it feel like when I'm unhealthy? What does it feel like when I'm just getting a little bit sick? And what does it feel like when I'm getting really, really sick and I need help from other people? Knowing our own level of health matters for our increased independence and our success. It also helps us continue in our education, because if you're not at school, you're not going to learn. And it also is important in our working. If you're not healthier to work, if you're not healthy enough to work, you're not going to be able to work. But health also comes with all these questions. Who do I tell? When do I tell them? Who do I have to let know about my healthcare needs? Well, just like everything else in life, transition is a process. Sometimes I wake up and I wonder, how the heck did I ever get here? Here I am. I'm in Stoughton, Wisconsin, sitting at my table, talking to some awesome people about healthcare transition. This was not what I thought I would be doing in 7th grade. How did I get here? It was a process of school. It was a process of finding different jobs, of finding out what I enjoyed doing. It was a process of growing up, of living on my own, moving back home, living on my own, moving back home. That's part of my story. That's part of my process. How do I make decisions? I don't make decisions the same way I did when I was 5 years old. I've learned and I've grown in my decision-making process. Healthcare is the same way. Growing in our health, growing in our self-health, our awareness, it's all a process. We don't start at the end. We start growing in the beginning and we add skills on, one skill at a time, until we build up the best capacity that we can to take care of our own health. So just like everything else, health is a process. So we have to talk a little bit about when do transitions occur? Because as this is a process, there's also times within those processes that we know are key milestones. So we want to look at what some of those milestones are. So normally, if I ask people, what happens at age 16? A lot of people say that's when I get to drive. Now, some of us don't drive. I know a lot of people in my life that they're just like, driving, not for me. My son, who's 22 with autism, we took it really slowly. We wanted to make sure he was really confident before he got behind the wheel of a car. And so it took a little while. At age 18, if you're 18 and you have the responsibility and you have the right to vote, it's when you're legally an adult, which means that you're also legally responsible. So if you enter into those contracts and you violate the contract, you're going to be in trouble. Now, what's the contract? Well, it's like a lease, buying a car. All these things, you become responsible for yourself at age 18. And then, of course, we know the transition at age 21 in Wisconsin is that people can drink legally and responsibly. Because we know that that's important in the state, but it's certainly not important to everyone. But it is another one of those milestones. So did you know that health rights in Wisconsin can actually change starting at age 12? At age 12 in Wisconsin, we have the right to some disclosure protections around our sexual health, and then somewhat extent to our mental health that continues to grow. So what do you need to do? Well, let's look at a little timeline. So we learned that at age 12, you can consent or not consent to some treatments, especially around sexual health and mental health. Well, then at age 14, if you're involved in the public education system, you're going to be started with what's called a post-secondary transition plan. That's where your IEP, your individualized education plan, is supposed to incorporate the post-secondary transition plan, which is focused on what are the skills that I need to learn in high school to help me succeed in college or in a job. So anything post-secondary high school. And so as part of your learning process, we put in plans. The plans get put into place to help you succeed outside of high school. And so that carries on through your entire rest of your high school. At 17 and a half, you should contact an Aging and Disability Resource Center. They're the people that are the gatekeepers for the long-term care program. So if you have children's long-term support and you're looking for long-term support as an adult, you'll go through an Aging and Disability Resource Center or an ADRC. They're in every county, and so you will have one relatively close to home, depending on what county you're in and where you live in that county. You can start to consider guardianship. A lot of parents consider guardianship long before their child's 18. It is something that needs to be planned for, but I also want to say that it's not something that should be taken for granted. I think we should look at how does supported decision-making come into this. I don't want to rush into guardianship because that takes away a number of rights. But how can my child, how can that 17-year-old learn to have as many rights and responsibilities at age 18 as possible? How can we support them in their decision-making without taking away their right to make? So guardianship is one option, but it's not the only option. You also have other dates that you're going to need to be aware of. There's a lot that could be put into place, prepared for before 18. Same thing with healthcare transition. Is that at age 14, according to our national partners at Got Transition and what we try to teach to our partnerships here in Wisconsin, is that at age 12, doctors should be talking with the youth and the families about transition, about the fact that there is going to be a change in care from age 18 to age 22. Sometime into adulthood, there's going to be a change in care. And so we want that conversation to start at age 12. We want the planning to start at age 14. So what is healthcare planning, transition planning? Well, this is where we talk about, okay, are you making your own appointments? Do you understand how to fill your prescriptions? Do you understand why you take your prescriptions? And so there's a number of different skills that can be developed between age 14 to age 18, help you take charge of your own self-health. Now, these are also things that as you may be over 18, you can look at it and say, I didn't even think about that. Maybe that's something I can take care of. And so this health transition can also be useful for older adults, 18 and older, who are looking at how can I take more charge of my healthcare. So in the healthcare system at age 16, we really want those conversations to be taking place with the youth and the adults about what is my healthcare going to look like when I change 18? Am I going to have to change hospitals? Am I going to have to change providers? Am I going to have to change insurance? Maybe I'm on insurance that are my parents' insurance that I then need to take over at age 18. Now, because of the national laws right now, you can stay on your parents' insurance until 26. And if you check with your insurance company, it's possible if you have a disability that you can remain on that for even your parents' insurance even longer. But that has to be worked out with your insurance company. And so that at age 18, the ideal, which is not for everyone, is to transfer to the adult model of care. But for some people, it's best to wait a little while. It's best to slowly transfer that care. And so we're hoping that sometime between the ages of 18 and 22, the transfer moves from a doctor that's focused on young people and our youth to a doctor who specializes in adults and understands aging, which I don't even want to talk about at my age. I don't like talking about aging. We're just going to go beyond that. But they are designed, the specialists are designed to deal with adult bodies and the way adults grow. And so hopefully all that information from your youth gets transferred to your adult doctor until by the age of 23 and 26, you are integrated, you are part of the adult healthcare program. Now, this happens at different times. What I'm here today is to help you figure out how can you help your family and how can you help yourself stay a step ahead, Stay where you are taking charge of your own health care. And so even though we have those ages for our doctors saying by 12 to 14 or 15 to 17 and by 18, we know people are at different parts of their journey. It's that my son didn't hit every milestone, that's for sure. But he hit them in his time, and we prepared for it in his time. And so with enough support, we believe that most people take charge of their health care. Now, how else can this be related? Well, if you think beyond the healthcare system, health is related to self-disclosure about how we talk about ourselves. Health is part of our daily living skills. How do I stay healthy? Health is part of the accommodations that we may ask for from an employer or from a university to accommodate our healthcare needs. Health is part of our rights and our responsibility. And it really does run closely with our employment about how do we talk about our health, who do we talk it to, and how does it affect our job? Well, you've heard me mention my son a couple of times. So now we want to take a listen to Hunter as he tells a little bit about his healthcare journey. So I'll give you a little bit of background as we get that set up. Hunter is 22 years old, currently lives with me and my wife. His sister is away at college, and we have been on this journey now, obviously, for over 22 years. But Hunter, so let's hear a little bit from Hunter about his healthcare journey.
Okay, Tim, there was a raised hand. I'm wondering if Sarah had a question while I get this set up.
Oh, I don't know if we can unmute Sarah, but Sarah, if you want to put it into the chat box, or Sarah, if you can try to unmute yourself, I'm more than happy to take a question. Hi, Sarah. I don't know if you can unmute or not with the way that we have it set up right now. Okay, Sarah, we will try to get back to you after the video.
Okay.
Are you seeing the video now?
Yes, we are, Beth. Thank you.
Great.
Hunter, I'm currently living in Stoughton, Wisconsin with my parents, and I am 22 years old, going on 22 soon. I started seeing my primary care doctor around the age of 16 to 18 after an introduction by my dad and everything. And ever since then, we've just really clicked. And me and my doc are relatively good at understanding what I need. And when I ask him specific questions, he does his best to answer them in a way that I can properly understand them. He doesn't confuse me. He tries to respect my personal boundaries when asking questions, and I respect his professional boundaries as a doctor. It's, as I said, a two-way street for respect and loyalty. I really do love my doctor. He's funny. The nurses he works alongside as well does the same thing. They are all really respectful people to personal boundaries. Their patients and myself included, possibly all really like them because of that. It was a hard road to get me independently to create my own appointments and everything. In the beginning, it was primarily me making the call and then my dad doing the rest. But over time, we slowly built up the bridges needed for me to do it independently. And then we discovered the most God-sent technology called MyChart. And ever since then, I've been doing it independently. And the first time I actually fully did a independent appointment was with my dietitian, a nutritionist and everything. And my parents, I just dropped a bomb on my parents, and they were wondering why. And I simply told them I talked to my primary care doctor. I asked, how can I help gain weight healthily and everything? And he recommended a nutritionist. So I set up an appointment without any input from my parents. And ever since then, I've been trying my best to do so. And MyChart really does help get you in touch with your primary care doctor and other doctors you have need of. It really was a godsend when we discovered it. The hardest thing for me to make my own appointments was keeping track of time. to make sure that I scheduled it properly within the time frame required to set them up, and also making sure I get there on time. Never really been good with time management. But thankfully, with my chart and my cell phone, I've been able to do so. Also, GPS helps a lot in making sure to avoid major traffic areas. So there are two tools that I definitely recommend people to get: my chart and a GPS that works. I primarily do self-talk in the waiting room about what questions I can ask and what questions that they can ask to prepare myself to answer. I primarily in the car listen to my radio, so if a good song comes on, I lightly sing to it to keep myself calm and focused. I find, again, that music is a very good tool for myself to calm down, to bring myself back into the realm of life when I'm off in my own personal world. It brings me back to the current reality. I started carrying my own insurance card again, possibly around the ages of 16 to 18. And it has everything required for medical emergencies, like let's say a minor car crash and I was unconscious and a good Samaritan was coming by and they saw. They could easily fish into my wallet and pull out my ID and my medical insurance card to understand, okay, this is what this person has and this is their current medical personnel that I can contact. So they can do so, and the ambulance would instantly also, with my medical insurance card, understand that he has such and such medical insurance, so we should contact them to help foot part of the medical bill. I keep my emergency contacts currently in my cell phone, but I'm also leaning towards getting a note card with them as well, so I can have one either in my wallet or in my glove compartment of my car and everything. Figure out how to set up your appointments with your parents' help. And if you are living alone, find a trusted friend or a colleague at your place of work. If they understand your disability and you have disclosed to them, explain to them why setting up these appointments are hard for you. See if they can help you understand my chart. See if there are other people in your lives that can help. And if you are currently seeing a counselor for any of your disabilities, listen to them and talk to them. They are there to help. They are a stepping stone on your path through life. Don't ignore the small little pebbles that they are. Pick them up and carry them with you. Even if you do drop them on later in life, they will always be a part of it. Never lose them. It's always better to work as a team than work individually when it comes to your mental and physical health. It's why we have doctors and therapists, dietitians, surgeons, pediatricians. They are needed parts of our world as much as parents are. Don't go it alone. Find people who will help you. Overall, my only suggestions to everybody is take your time.
I love that kid. He's pretty darn amazing. All right, let's see if we can unmute Sarah and be able to answer the question along the way here. Sarah, it looks like you're unmuted. What was your question?
It was actually a comment. You mentioned guardianship. There is such a thing as partial guardianship. Like, my mom has partial guardianship over me, over health and money, but I can vote, I can marry, I can own a house.
Yep, and that's important to find how you can protect your rights that are important to you while also getting the help you need in other areas. And so partial guardianship is definitely one of those options, as well as there's some power of attorneys that you can look at as well. So Sarah, thank you so much for reminding me about the fact that it's not, guardianship is not all or nothing, is there can be partial guardianship. So it's important to figure out what sort of support do you need making decisions. I just have one more area that I want to cover, and then we're going to listen to Abby. I just want to let you guys know that out on our website there's a workbook, there's a whole lot of resources, but most importantly, what we also have, what we stress is called our 8 tools that you can use to help ensure your healthcare. So if we look at the 8 healthcare transition tools, we can just skip ahead to the transition tools slide. I want to go ahead and just briefly talk about each one. So we can go one more slide in. So we've already talked a little bit about our adult providers, who's going to take care of you as you become an adult. Your specialist might change, as well as your primary care. We've talked about how to make decisions. Sarah reminded us that guardianship is sometimes not all or nothing. You can have partial, you can choose partial guardianship. You can have powers of attorney. At the least, you can have also release of information, which is what I have with Hunter and my daughter, Sammy, so that if needed, I can talk to her doctors, but she's making all of her decisions. Also then supported decision-making tools. There are actual tools that you can set up that says, hey, this person helped make my decisions for my car. And so they're going to be a part of this discussion, or this person is helping me make decisions about where I live. And so they're going to be part of those discussions. Again, you're the one that makes the decisions, but what you're saying is that these people help me make the decisions. Guess what, folks? That's what we all do. I don't make decisions on my own in this life. I look for those people that I trust and that can help me make the best decision possible. Just a way, supported decision-making is a way to let other people know that these people are involved in helping you make your decisions. Also need to determine how long can you keep your current health insurance? What do you need to keep your current health insurance? Do you need to reapply each year? How long can you stay on your parents? If you're on a public insurance option, Badger Care maybe. How do you make sure that you maintain, you keep that health insurance? It's not just important to get health insurance, but how do you keep health insurance? We heard Hunter talk a little bit about emergency contacts. We also heard him talk about appointments. Medications is also a huge area that, understand, why do I take this medication? What does it do, so that I know if it doesn't do that it's not working and I need to talk to somebody about that. If we don't understand what the medication is supposed to do, then we're not going to understand if it stops working. And so learning how to take medications, what they're for, and how to refill them. I've had many youths who are very surprised when they went away to college that they ran out of their medication. But why? Because back home, they were used to their parents doing all the refills. And so they'd go to the medicine cabinet and they always had medicine there. There's like a medication fairy. It's never empty. The bottle's always full. And then they moved out and they're like, oh my gosh, I have to be the medication fairy. I have to learn how to call in for my prescriptions and I have to learn how to pick them up. So if those are skills that you want to develop, you can work on that in figuring out what medications you take and how can you refill them. Where do you get those refills from? And then a health summary is something you take with you for the rest of your life. It's just this basic health summary. These are the major things that you need to worry about. These are my likes and these are my dislikes, and it falls right into about me. I have talked way too much. Let's move on from these skill builds and these tools and everything. Let's see if we can apply them IRL, in real life. Hashtag IRL. Abby is our hashtag IRL. And so I'd like to turn it over to Abby and talk a little bit about more how these things actually work for her.
Abby, so I'm going to ask Abby some questions. First, Abby, can you just tell us maybe a couple of, spend a minute and tell us a little bit about yourself?
Sure. So I'm Abby, I'm just turned 30 this year. I have cerebral palsy, and I'm pretty active within the disability policy realm.
So Eddie, we would like to first talk about adult providers and appointments, those first two tools, and the About Me, actually, so 3 of the tools. So when did you start to see a doctor for adults?
I started seeing a doctor for adults around middle school age. When I first moved off the farm into a city area, immersive, yeah.
Okay. And what do you like about your doctor?
They're more like able to they understand me. But I have to go in with more of like what I actually need from them, and then they're actually able to form a relationship with me and my family, and so I feel like I'm invited when I go in to see the doctor.
Great. So how do you prepare to go to your appointments?
I like to think about like brainstorm idea, like why I'm gonna go in, or think about like what I'm actually gonna go in and like explain. Oh, this is why I'm going in. It's more of, I mean, you just can't go into the doctor just because you want to go in and get a, you know, just, I mean, there's got to be a purpose to go into the doctor at the, like, and, but, and so I would just be like, when you got to think about your symptoms, so the reason why you're going in. And so, but I would also highly recommend listening to your body. If something isn't going right, write down what's going wrong with it. And if it's hard to went in front of the doctor to actually get your words out, maybe go in with a couple note cards, or with what's really bothering you.
Okay. And what about preparing to actually get to the appointment? Can you talk a little bit about that?
You should probably consider what type of appointment is it? Is it like going to the dentist, where you can just set it up on your own and go get to the dentist on your own? Or is it like going to the doctor where you need your parents there with you? If it's something where you need your parents there with you, then you need to think about, oh, I need them to help schedule the appointment, or make sure you schedule it 3 months out so that they can attend with you. That kind of thing.
Okay, great. Thank you. All right. And this is something that you and I talked about as being extremely important. This kind of falls under decisions, the tool of decisions. Can you give us some ideas for how you are more comfortable at your appointments?
I feel comfortable bringing, well, depending on the appointment that's being made, I'm comfortable bringing either my mom or a trusted friend to the doctor's office or dental office, what have you. Unless if I know what's gonna occur or happen in the actual appointment. But it doesn't have to be that. If you prefer to bring in a fidget, I mean, obviously not your dog, but a stuffed animal or your favorite book, that might help. But yeah.
And how do you remember what you're going to talk to the doctor about?
I would suggest thinking about like what you're gonna talk to your doctor about the night before, like over dinner or over breakfast and like a phone conversation with your mom. If you perhaps think you may forget, you can also maybe come up with a strategy of bringing your cell phone into into your appointment and FaceTiming your mom so your doctor can so you have another set of ears and eyes and ears on the subject if you think you might forget. Or you can also bring a notebook and have your notes down in a notebook or your phone so that it's like your personal accommodation for your appointment.
That's great. And I'll just say that I've also done that for my son when he went to the doctor with a friend. And the doctors are very willing to have a parent or other person call in on speakerphone or FaceTime. So I think that's a great idea. All right. So let's move on to insurance and emergency contacts. Where do you keep your insurance card?
I would suggest maybe in your wallet or like a safe at home.
Okay. And what about emergency contacts? Where are those?
I would say for your emergency contacts, have it in numerous places that you know where it is. I mean, obviously, of course, have it in your note section in your cell phone and a card in your wallet. So that way it's accessible for if you got in an emergency somewhere and you can't like verbally talk. Or if you got unconscious or something, the police can access it easy without having to bother you.
All right, and now decision making. So Abby, do you have a guardian?
I'm my own guardian, like legally.
Okay. So tell us about your supporters who help you with decision making.
I have I have circles of teammates. In town, I have an Irish aide that's a living. My sister lives with me, and she's my Irish aide. But then I have a job development team, and then an Irish staff team. So that's and so yeah, I can list all them up, but that would take 10 minutes to do that. And then outside the Madison area, I mean, there's circles of outside Madison as well. Like there's the circle of friendship. There's the circles of family relationship building. I mean, you're never going, I mean, it all depends on, like, it always, the type of decision you need to make, there's always a circle team for that purpose. And so the biggest struggle that I can really see that's coming into play is knowing what decision team you need to pull to like to figure out the solution to that problem. There's always a circle of teammates out there that's willing to help you. It's just figuring out which circle of friends to help you out with that.
Great. Right. So let's talk a little bit about disclosure. When do you think you should disclose to your employer?
I think, well, it depends on the conversation, to be perfectly honest. I think, if you really want the job to the employer, I think that you should like the second time you see them in person, you can notify them and be like, I have a disability, I need these accommodations. Or and you know, but there's also sometimes where, you know, if you have a disability, you can always just say, like, look for a part-time gig. And then, because then you don't have to, because part-time gigs are easier to like monitor, or are easier to adapt to your specific needs, versus a 40-hour gig. It's too hard. It's maybe a little too complex to come down to your needs, but that's just me.
Okay. All right. And one thing that you mentioned when we were talking is that thinking about the words that you would use to
Oh
disclose.
yeah,
So,
I would just be really cautious about the lingo or the language and how to disclose about your disability too. Like, do you like, in depending on the type of group, you know?
yeah, and we talked about using like the language of things that you can do rather than not than things that you
Right.
can't. So, like one example was, I need to take a break and sit down every hour, or I need large print, things like that.
Yep.
Okay, great. What about your education institution? When would you disclose there?
I think, like, in general, most professors are going to be okay with you telling them. I think for like for a professor, some of them may be like, oh, okay, whatever, like, no big deal. Just here's your essay, you know. But otherwise, some of them are gonna, like, their reactions might be different. I think that, if you're looking for the, like, disability help in a classroom, you need to look at your disability help service desk or resource, opportunities that are there, versus, is this course going to be suitable to accommodate people with disabilities? That's, I mean, if you are going to consider going to, like, College, for instance, and you're like, oh, I want to take like British studies or something. Well, first off, before you even consider that, you need to think about, oh, well, is their disability like program? Or, like, there's always, like, research that you got to do before you can consider. So
great. And what about your friends? Disclosing to friends?
I think it's part of, like, relationship building. Some of them may be like, oh, I think that, like, they may not care. Some of them may be like the chatty ones, like, have to blur it all up, but I don't know. It's I don't know.
I think you mentioned to me that, you would wait maybe until they ask.
Yeah.
Okay. All right. And wait until you get to know them better.
Right.
To get to know those personalities and what they'll do with that information.
Right. It's kind of hard. Disability disclosure. But I mean, heads up, those are all my personal opinions and my experiences. That doesn't necessarily mean that it's the right choices for you. Like, as
right.
we all have different like vocab terms of disclosure.
All right, well, Abby, thank you so very much for sharing with us. We are going to turn this back over to Tim now. So go, Tim.
Thank you, guys. Abby, thank you so much for being here. I just always enjoy listening to you talk. So thank you very much. It's matter of fact, I wish I would have talked less so that we could have had you talk more. But kind of speaking of this, I'd like to bring on, I've had a little chat with Aaron in the chat box. Aaron had put into the chat box about, I don't know anyone who goes to the doctor if they don't need something. And I gave Aaron this wonderful response that was off the mark because that's who I am. Is sometimes I get confused and I make assumptions. So Aaron, I'm wondering if you would like to sort of talk about what your question was about and the fact that sometimes we have to talk to doctors that we're not faking our disabilities. There's stuff that we need to talk about. So Aaron, if you could unmute yourself, I'd like to give you a chance to talk about that. Aaron, if you want to go ahead and try.
Tim,
yep.
Can you hear me?
Yeah, we got you, Aaron.
Yeah, so I've been hiding my autism at the doctor's office because I didn't want to get hurt. And I don't know how much longer I can do it. I'm just trying to figure out how to connect the pediatric world to the adult world. And honestly, their mind is still in the 60s.
Yeah, you're right. There's a lot of differences between the pediatric and adult doctors. The pediatricians seem to be more on board with autism and disability than some of our primary care doctors as adults. So how have you tried to explain your disability to your doctor? Have you had any success with that?
Well, I've had some success. I've been bringing some things from the kids world over into the adult world. So things like social emotional learning. It's all that stuff. Like you see stuff on Sesame Street, like that 5-finger candle, like blow out one finger, blow out another, blow out another, blow out another, blow out another. It runs the risk of people treating it like a baby, but they still understand it in some ways.
Mm-hmm. You're right. I think it's important to figure out ways, that whole sense of communication. Is that doctor really listening to me? And what can I do to help that doctor understand and listen to me?
I'll also be helping my autistic friends who are your age, Tim, and that's even harder.
Why? Because we're so old? Because I'm ancient, Aaron?
No, because the world changes in different rates, especially
yes, it does.
The adult world. They're a little slow to accept new ideas.
I agree. And it's important to, somebody else had in the chat box, that it's important to find a doctor who's going to listen to you. That's going to help, not every doctor is going to know about every disability. And so at least find one that wants to learn about it. That wants to, in your case, learn about autism. How does that affect your life?
Honestly, like I said, I've been hiding my autism because I'm afraid I'm going to get restrained or something. But the only thing is, it's getting more important now because I don't know how much longer this can hold. I can't do Hail Marys much longer.
Yes, is finding a doctor that understands all of you, and our disabilities are a part of who we are. And so, trying to find a doctor who understands that is very important. But it can take time, and it can be very frustrating.
You bet.
I was going to say, oh, well, thank you, Aaron. I'm sorry. I didn't mean to interrupt. All right. Tim, I was just going to say that Terrell has shared a really good experience with phone calls with the doctor on the chat box.
So Terrell says, I go to the doctor, or he can or she can call my phone to make an appointment. And so far, everything's going great with his medication. So Terrell, it sounds like you are in charge, taking charge of your healthcare. Terrell, did you want to share with us as a group as well to follow up on that? If so, we can try to unmute you. I'm trying unsuccessfully.
Is Terrell, is he joined via phone?
Oh, good point. I don't know.
He would have to press *6 to unmute himself.
Oh, he took a quick break and he's going to come back. So we may have time, we may not have time.
Okay.
I know we only have a couple of minutes left and we only have a couple of slides left. And so I'm just going to run through these because I love the animation on this one. Is what we're talking about is the fact that it feels like growing up that you start to have one foot in the adult world boat and one foot in the childhood or the pediatrician boat. And it's really important that as we get older, those boats are going to get farther and farther away. And so we want to find a doctor who's going to be able to take care of us and our disability and understands our disability as well as the pediatric world, or as well as they can. Sometimes the pediatric world just does a fantastic job. So just some of the resources that you'll find if you go to the Youth Health Transition site is our brochure. It's all about staying a step ahead and helping people understand that there's some decisions that have to be made before age 18, along with our Health Pocket Guide, which again transforms through, and we are on Facebook. Our national partners include Got Transition, and they have a wonderful transition readiness assessment so that you can gauge what you do know and what you might want to learn a little bit more about. Across Wisconsin is a wonderful organization of teenagers that are part of the PATCH program, PATCH Teens Communicating for Health. And they are doing online webinars for physicians and nurses and social workers, as well as for other teens. So if you're a teen, you want to hear about healthcare from teens, think about getting your group together to have the PATCH organization present to you. Board of People with Developmental Disabilities has a fantastic self-directed healthcare kit. And so you might be thinking about what your next steps are. Well, it's all about conversations for me. Start talking to people, start talking to doctors, start talking about your nurses and saying, you know, are there other doctors that may understand my disability a little bit better? Visit Health Transition website, get some resources, look at the transition readiness assessment. And then we're going to end with a final poll. And this is obviously where I talk too much. And so let's put up the poll about that during this presentation, did you next is the other poll down on line 3? Do we have to scroll down, Beth?
I'm trying to scroll down and it's not scrolling. Okay, end that polling.
Okay.
Oh, shoot. Well, I don't know. I'm not getting the second poll.
Okay, well, forget it. We're not going to do that second poll then.
I can launch the second poll if you'd like me to.
Here we go.
Oh, yeah. There you go. So yeah, we would love to know if you learned something new about changes to adult healthcare. And also if you have any ideas, like you know now that there's something else that you want to do to take charge of your healthcare, to take better charge of your health. Because again, as I keep saying, is that we're all at different stages. And so there's going to be some things that we can do. There's going to be some things we can't do. But being the healthiest we can be is one of those things that affects all the different areas of my life. It affects where I live. It affects my friendships, how I can work, if I can work. It affects my schooling. Health is one of those things that I consider to be foundational. And so learning how to be as in charge of my health, learning more about my self-health, how I feel when I'm well, how I feel when I'm not well. How do I take care of myself? How do I know my medications are working? These are all things that have to do with self-health. And the more that we are aware and the healthier we are, then the better our lives are going to be. So thank you so much. It looks like most of you learned something. And most of you have a plan for change, which is really encouraging because it's good to know that we weren't just sitting here talking to dead air. We appreciate you being here. I think we only have until noon, but we do want to put up our contact information. Sorry that the poll didn't pop up for some of you, but thank you so much for being here. We'll leave the contact information on for a minute. I don't know if we have time to take any other questions in the chat box or to unmute people. I am just not sure how much time we have. Do we go for an hour?
We can take until 12:15, technically.
Yes. Good.
Yes.
Then let's go question and answers. Yay. Questions for Abby. Questions for Beth, questions for me, questions for each other, statements, places where I was absolutely positively wrong. Put in the chat box or maybe raise your hand and we'll be able to, we have awesome Jess from a self-determination conference who is helping us navigate.
I'm also, Tim, I'm also going to be posting I posted it right away. But I'm going to post it again, the CEU form,
great.
The link for that for participation, I believe. So I'm posting that right now. If you just want to let everybody know that
So
that is in the chat.
If you need to apply for CEUs, there is a link in the chat box. CEUs are continuing education units. And so there are some professions, some people that if they take certain courses or attend certain things, and they get credit for it. So there's a form if you are needing to link to the continuing education unit. The link is in the chat. So please put questions in your chat form in the chat and we can try to answer them. Or raise your hand and we will attempt the unmute process. Because we do have time that we'd love to have a discussion.
Tim, I could go back to the regional centers slides. I don't know if the person who asked about that is still on or not.
I'm also wondering if Terrell is on and if Terrell wanted to share with us how he worked with his doctor. Terrell, are you back? Or if you're on phone,
yep.
*6.
Yeah, if you're using a phone, press *6 to unmute yourself to be able to talk. Otherwise, I did give everybody the ability to unmute themselves right now. So if you go to the bottom left corner of your screen, you can unmute yourself that way as well.
So don't everybody do it at once, but please feel free to unmute, give a comment or a question. And Terrell says he is back. So Terrell, if you're on the phone, *6 will unmute. If not, it looks like Kevin might have something to say. Kevin?
Hello. Can you hear me?
Yes.
Hi. I just, nothing, I don't know nothing, I just see like you could, as you talk, I just trying to unmute myself. Well, you guys, yeah, that's just like me being on my phone, using on my laptop. But my girlfriend said, I'm using my phone.
Yeah, that's a good suggestion for the phone.
Yeah.
Thank you, Kevin.
Yep. So you guys had time, but I came in late.
Oh, you're breaking up a little bit, Kevin. I'm having trouble understanding.
What are you talking about? Oh, sorry. I'm in, I go back to, I go in the bathroom. I won't talk.
Okay.
Listen.
Okay.
Listen.
Sounds good, Kevin. You listen and we'll see if anybody else wants to talk, like Terrell.
Sorry, but it's hard to hear people on my phone. Try to listen to you guys. Sorry about that.
Oh, that's fine, Kevin. Thank you so much.
Yeah, bye.
Bye-bye.
Bye.
I'm wondering if everyone can find their regional center by where they live, by the map. Because I think we got a lot of no's when people said that they had not contacted the regional center.
So we put the regional center back up, the map back up, so that if you need to find your regional center, even if you're over 18. You can call them and they can help you find your Aging and Disability Resource Center in your county or your Independent Living Center. So they can still be a resource to you. So note which one is yours, and they are going to be able to provide the information on resources that are closer to home than just statewide. So it looks like we have someone who is unmuted. Looks like the name of owner. Did you have a question or a comment? Yep,
yeah,
go ahead, owner.
I think I found where I live, right here.
Okay, thank you. Thanks for being here.
And it's
Sorry, what? Sorry.
It's Jack, not owner. It's Jack.
Oh, Jack. Hi, Jack.
Yes, because my computer says owner, but I'm Jack.
Okay.
Jack.
Good to have you here, Jack. And Terrell, I am not able to unmute you either. I don't know what's going on. So I am sorry that we can't get to you. We do have a question about telehealth, how it's going for families and barriers that they're having. Has anybody been able to access telehealth that might want to let us know how that is going? We have not had the opportunity in my household, as neither me or Hunter have needed to contact our doctors over telehealth. So I've heard from other families that it's been going really well and that they appreciate not having to travel out. But is there anybody who has been utilizing telehealth that would like to let us know how that's been going?
I was going to do it one day, and then I was done, and then it didn't work for my laptop.
Thanks, Kevin.
I wish I had telehealth, but I did it before, but not at home.
So somebody wanted to talk to about telehealth?
Yeah, I can't do it at home. So I go right to the doctor's office and talk to him about it.
This is Ramsey. I was telehealth from my counseling, and it seems to be going good.
So it's going good?
Yeah.
Glad to hear it. That's fantastic.
Thank you for presenting, Tim.
Thank you.
You're
for
welcome.
help.
Thank you. Anybody else having experience with telehealth?
Tim, I actually had a telehealth visit. And
oh.
Yeah, and it was, I will say that at first it was a little weird, but, you know, talking about just being in my house and talking to the doctor. But then after a few minutes, it was okay. And I felt like, you know, I could speak with him and, you know, talk to him about things. And he had someone else in the room with him for my, you know, safety.
Oh, well, that's different.
Yeah.
I didn't realize that that might be a possibility.
I have a question.
Yes, please.
And this, I don't know that this relates to anything. This is just, I just am curious and just wonder if anybody that is in the audience has any experience or information. But for sleeping at night, like if, I don't know if any of you have to be rolled at night, if you're a quadriplegic or may have some other disability, but I was wondering, does anyone use like an air mattress or any special equipment to, you know, roll at night? Or does an air mattress, for example, you know, that the air goes through, in and out, if that helps anybody. Does anybody have any experience with that?
Good question. I know I don't. So anybody out there?
I have sleep apnea. I use a machine.
So you use a machine to help you, Kevin?
Yeah, I have sleep apnea.
Okay.
Is it like an air machine?
No. No, it's not an air machine. I have water to it.
Tim, could you repeat that? I'm not getting very good reception.
Nope, I am not getting good reception either. I'm sorry.
Okay, go outside.
Kevin, I heard you say that it's not an air machine.
No. I put water inside it.
One more time, Kevin. Could you just repeat that once more?
I put water inside it. That's an air machine.
Yeah, I am. I'm sorry. I'm not.
It's a sleep machine. Well, right down.
Oh, so you have a sleep apnea machine that helps you breathe during the night.
Yeah.
Oh, okay. Okay, I see.
There is someone in the chat who said that air inflated mattresses can help with preventing bed sores if they've had success with their mattresses.
Great. Oh gosh, that's interesting. They can assist with preventing bed sores.
Mm-hmm.
Yeah.
That's something I didn't realize either.
I did not. Thank you, Diane.
Okay, well, I think our time is about up. Is there anybody else that would have a question for the group or a comment? I'm going to go have lunch. I'm kind of hungry. Well, I want to thank everybody for being here. Thank you for interacting. Kevin, Aaron, Terrell, I'm sorry we could never get that figured out. And everybody else who connected and asked a question, we really do appreciate it. I hope that you have a great rest of your day. Please, again, feel free to check us out at Youth Health Transition website for our tools and resources. Our contact information is on the screen. Beth, Abby, did you want to say any closing words as well?
I'm good.
Oh, thanks, Abby. Thank you to Abby and Tim and everybody who stayed on with us and attended. And yeah, the Youth Health Transition website is a great place to find resources and upcoming events. So please check it out.
Fantastic. Have a great rest of the conference. Way to go, people. You're doing something forward moving. Yay. Keep it going. And remember to vote if you haven't. Have a great afternoon.
Thank you, Tim.